let's dive into belly massage. This is going to be for the early days postpartum. Belly massage looks different for pregnancy, and it's going to look different for later on postpartum. If you had a belly birth, aka a cesarean, then I encourage you to wait till the end of this video to see the modifications for yourself, and also to look for the video that I'm going to send you on what you can do for post-cesarean care. Starting off, why are we doing belly massage? Well, these muscles go through so much during pregnancy and labor, and even those initial days postpartum, that we want to work on any areas that are tender. We also want to work on blood flow circulation and lymph flow circulation for everybody, and especially for those mamas who had a cesarean. Where you're going to start is the rib cage border. The rib cage border gets really tight because of where the muscles insert, but also because the diaphragm is lining this area. And the diaphragm goes through so much. It's shoved up because baby's in our belly, and then it works so hard throughout our birth. And then postpartum, we have slouch posture. So our diaphragm is really struggling here, and so are these muscles. So what you can do is take a little hook hand, and you can go underneath your diaphragm, underneath those ribs, and go back and forth. You can use your breath where you inhale, exhale, and allow your hands to sink in and massage there. Or you can do circles. You can just take those fingers and do circles. You don't have to grip underneath your ribs. And I'm extra flexible, so I can grip under. You may not be able to, and that's okay. So just these circles along the rib cage border. Then you're gently going to do a broad hand, and you're going to go along your obliques. Again, the intention here is not to go crazy and really work out some crazy muscle tension. It's just to start getting blood flow there and work on some of those sore muscles. If you find an area that's a little bit more sore than others, you can stay there and use your breath to get into that trigger point. You can go all the way as low as down into your ilium, which is that hip bone right here. And after you've done the rib cage and the obliques, now you're going to go up the rectus abdominis, which that muscle has a lot of trigger points in postpartum women. It is the muscle that stretches out the most during pregnancy, and it goes through the most stabilization out of the other muscles. So it gets a lot of work. So ends up with a lot of trigger points a lot of times. So you're going to come into these muscles here. Little circles as you go up all the way to the top. After you've done more of that pressing in type massage, we're going to actually do a fascial pull. So we're going to lift the skin. Although that feels a little insulting postpartum because we have extra skin, you're going to lift the skin, and you're going to see where you have different tension in your body as you pull. So you can do big circles with that. You can go up, you can go down, you can go side to side, find another area, same thing, go up higher, same thing. And we're just releasing any tension in this abdominal wall because it really does go through so much, our poor abdominal wall. Now, if you had a belly birth, a cesarean, we are going to do things a little bit differently. We are not going to be doing this fascial pull. The only area right now in the first 6 weeks that I am okay with a fascial pull is up near the rib cage if you're feeling tight through here. I don't want anything below the belly button that you're doing a pull and tugging sensation on. That will happen later after the 6 weeks and the initial scar has healed. But what you can do is you can still come across the rib cage border as we demoed. You can go along the obliques. I would go not quite past the belly button in the obliques. You'll go to right around here. And then you can do that same rectus abdominis work up from the belly button to the top, basically your xiphoid process right here. So same stuff you can do. You're just not going to go below the belly button, and that fascial pulling is going to look different. You can also take your hands and you can go over your scar and take some nice, deep, expansive breaths, trying to push that air into your lower belly, which is not usually how we breathe, but this is just for some mobility for that region of your body, is that breath is pushing really low. So that's how we can do belly massage in the early days postpartum.